Well, it's the new boy on the block. It didn't exist in inverted commas until fairly recently. It's a recently recognized condition. It's called MCAS for short. And I think probably the easiest thing to do is to explain what mast cells are, because if you understand what that's in, then you'll understand what MCAS is all about. Mast cells are all over the body. They are on the skin, in the gut, in the respiratory system, everywhere that's exposed to external factors. They're very important in the immune system. They're, in fact, the first line of defense. So they are consistently, continuously watching what's going on in the environment. And if any nasty activates them, they get very excited and spew out lots of nasty chemicals. That all is great when everything's working fine. What happens with MCAS is that these little chappies get very excitable and are triggered by things that shouldn't trigger them whatsoever. Things like, stress, heat, cold, loads of stuff that wouldn't normally excite them at all. And when they're excited, they spew out, it's actually recognized about 1,000 chemicals that they have inside themselves. And they spew out a selection of these chemicals and cause all sorts of horrible symptoms that make the patient feel very unwell. Because these mast cells are everywhere, they affect almost every system in the body. Skin rashes, they affect the gut, they cause nausea, vomiting, diarrhea, bloating, respiratory system, you're talking about wheezing, coughing. It affects every system in the body. The multitude of symptoms is unbelievable. And that's actually one of the problems with MCAS. It's a very difficult diagnosis to make, because when an individual explains to the doctor that they've got, so many symptoms, A, B, C, D, E, F, G, H, I, J, K, and N, and so on and so forth, the doctor just looks at them and says, can't be possible. It just is not possible, because there's no underlying simple unifying diagnosis. And a lot of these patients are misdiagnosed as chronic fatigue, fibromyalgia, functional, lots of different diagnoses. And that is a real problem. But luckily, MCAS is slowly but surely becoming better recognized in medical circles. And so that's a good thing, because it means if you treat the thing, people improve and get better, and that can't be bad. There's no adverse effect on life expectancy unless you get anaphylaxis. Anaphylaxis can happen to anybody, but it's more of a problem in individuals who have MCAS and things like that. But the incidence of it is small. So really, the vast majority of people with MCAS, no impact whatsoever on life expectancy, unlike so many other illnesses. The people just feel miserable for a long time because of uncontrolled symptoms, and probably life seems longer because they feel so unwell, if you understand what I mean. Loads of stuff that we do. One of the first things that we ask is if the patient is aware of any triggers. And some people will say yes, things like, food are an important trigger. Other people will say, exposure to sunlight or whatever. So try to identify the triggers and try to eliminate the triggers. If that isn't successful, they're still having issues with the MCAS, then we move on to medication. And we're just talking about simple antihistamine medications. H1 and H2 antihistamines are the common starting point that we do. But I mean, there's so many other things that we do after that once we've made the diagnosis of MCAS. But the starting point is the antihistamines, and a lot of people surprisingly feel so much better by taking just an over-the-counter antihistamine. They can't believe it. Quite interesting. Well, if one of the things that's released by the mast cells is histamine, and lots of food have histamine. And some people recognize that foods high in histamine are triggers. So we give them information on foods with high histamine. They scan down the list and say, oh yes, I eat A, B, C, and D. They cut them out and see if it makes any difference. Some people it helps, some people it doesn't, but it's certainly one of the important things we do. Other people will try, you know, dairy-free, gluten-free, whatever. So, and sometimes things like, you know, FODMAP as well. But it's an important part, but it isn't the whole answer, unfortunately. If it was, it'd be very simple. So quite often people have to move on to medications, not just, you know, medications that are actually prescribed on a script. A lot of antihistamines you can get over the counter, and a lot of other things that we use, mast cell stabilizers, you can buy in a health food shop. You know, they're not cheap, but when they work, the people are very happy to spend the money on making them feel better. And, you know, quite honestly, I've seen people who've been ill for years with unexplained symptoms. I've been to see so many specialists, you know, gastroenterologists, neurologists, rheumatologists, immunologists, the list just goes on. And yet MCAS doesn't come up with a diagnosis. When we make the diagnosis and start to treat them, they sit back and say, whoa, this is good. These antihistamines, dead cheap, so easy to take, and they make a big difference in how they feel. You know, I have people who've promised me hugs over the internet, which is quite nice.